Okay, so ladies and gentlemen, welcome back to the TCM community. And today I'm talking with Dr. Aram Akopyan. With over 26 years of combined professional experience, Dr. Akopyan has a unique mix of skills and abilities. He has 14 years of IT and high-tech experience, a master's degree in computer science, and a master's of science degree in acupuncture and traditional Chinese medicine from Yosan University in Los Angeles. Now, he's completed his residency at Sichuan Academy of TCM in Chengdu, China. And to further increase his clinical skills, Dr. Akopyan completed his degree for a medical doctor. He has over 12 years of clinical experience in healthcare. And in recent years, he successfully started a wellness center in Thessaloniki, Greece, and is active in philanthropic work with a Swiss NGO providing acupuncture services to regions devastated by earthquakes and floods. Dr. Akopyan holds the honorary position as the Director of Scientific and Clinical Research for the Yerevan State Medical University of Armenia, the YHU, where he is currently overseeing the clinical studies and research. He also helped establish the Human Anatomy Dissection Laboratory for Cadaver Studies at YHU. And he's also a professor at YHU and Athens College of East Asian Medicine, teaching physical medicine and rehabilitation and human anatomy, and also acupuncture and TCM herbology. So that's a whole mouthful. Welcome, Dr. Akopyan.
Thank you. Thank you for having me. I really appreciate it. That is a mouthful.
Yeah, and I hope I got the pronunciations correct for some of the.
Yes. Mostly, it's Yerevan Haybusak University, not Yerevan State, but that's okay.
Okay,
that's
there
fine.
we go.
That's good. That's good.
So anyway, welcome to the channel, and looking at your background, what got you into this specific medical field?
Yeah, that's an interesting question, and I'd like to say that I'm probably on my second or third professional iteration in this reality, my second or third life, if you will. Okay. I had a midlife crisis, and like most who end up in this field, in the field of wellness and healing, if you will, have some sort of a jolt. Like taking the red pill rather than the blue pill, and waking up in a pod, right? So you get this reality jolt that wakes you to the truth, and you start reevaluating yourself. I was a very successful executive in working for very large multinational corporations, both in America and internationally, and what happened was my grandfather passed away, who was a very esteemed healer in the old world. Mm-hmm. And he left me his manuscript, if you will. And upon opening it, upon starting to study it, I was spurred to reevaluate myself, to kind of reevaluate my life. And I found it to be lacking in many areas. So I decided, unlike most people who at my age, at 35, have a midlife crisis, to purchase a fancy sports car, I decided to go back to medical school, which was a decision that was very life-altering for me.
Where did you receive your undergraduate and professional degrees?
Well, as you mentioned, I had the fortune, after doing the pre-medical courses and the pre-med certifications in Los Angeles, I was very fortunate to actually run across a phenomenal school, an exceptional school. Yosan University is probably one of the most esteemed schools in this medicine, and primarily because it's a heritage school. It is a 37th generation Taoist school, and the focus of the school is not just teach technique, but to immerse you in the philosophy of Taoism and in the concept of our medicine and the teachings of the classics. And I was literally blessed to have the opportunity to be accepted in that school, and completed my master's degree with highest honors And then subsequently, as a result of that, I was selected to be one of the few students that got the opportunity to continue their education and their residency program in China. So I studied at the Sichuan Academy of Traditional Chinese Medicine in Chengdu, did my residency there in both the adjunct hospital in physical medicine and rehabilitation, and also some work within the oncology hospital there as well. Okay. Now, after finishing that, I got back to America and, set up my practice and started practicing. And this is where an interesting turn of events occurred. I started integrating within the overall broader medical field. Mm-hmm. So you start referring, you start working in conjunction with other professionals, MDs and OBGYNs. I started getting heavily involved in fertility, in adjunct therapies in fertility clinics, specifically working with embryological studies and doing IUI, IVF procedures in a combined acupuncture therapy. And I found that my knowledge in Western medicine was lacking, to be gentle, if you will. Mm-hmm. And so, again, spurred by that desire to improve my education, I decided to go back and finish my MD. And that's how I ended up in this state, if you will.
What made you move to Greece, and how are you involved in the TCM community within Europe?
Well, Greece actually is just a comfortable, a central location for me. It happens to be my ancestral homeland. But I found Greece to be central to Europe, central to a lot of the areas. I mean, I do work across the globe. I'm still involved in projects and work in China and Sichuan. I do work in universities in Armenia, in Russia. I teach in Athens. I'm still involved in America, doing projects and work within the United States. So centrally located. And as far as my involvement in TCM, besides the fact that I'm an active professor at another very unique school, Athens College of East Asian Medicine, I find to be another unique in that it is a heritage-based school. So besides teaching there, I'm actually actively involved with the European TCM Association, the TCMA, on their research task force. So we're working together as a community to enrich the available research and also engage in more research that could, we'll talk about how we can improve our prospects of validating our medicine and also being integrated into the overall process.
I wanted to talk about you about the integration of TCM in general healthcare systems. So like we see, for example, in China, Taiwan, or Brazil, a successful integrated healthcare system would facilitate more efficient use of domestic medical resources, right? Not only for resource poor countries, but also benefit industrialized nations, for example, by easing the load on the already burdened allopathic system. Mm-hmm. So, but before we get into this, though, I think we should take a look at some geopolitical definitions people are using when speaking of medicine. So, for example, we have this, in my opinion, biased terminology of Western medicine and Chinese medicine, right?
Yes, yes.
So by correctly defining these terms, we get rid of the politics in the very definition of the words. So I think it's important before we go on, like instead of Western medicine, would be better to use allopathic medicine, for instance. What is your take on this?
I wholeheartedly agree. In fact, all medicine is medicine. Mm-hmm. Labeling them, even by our standards, I see a lot of our practitioners defining themselves as, no, I'm a Chinese medicine practitioner. Yeah. You're a healthcare provider. Start thinking along those lines. Mm-hmm. Because ultimately, if you separate yourself, you segregate yourself. Don't label things. Western medicine is medicine. Chinese medicine is medicine. African medicine is medicine. Anything that deals with patient care that is responsible for providing good patient outcomes is healthcare. And if we can blur the lines, if we can eliminate these classifications, we can be more effective in fitting within the overall healthcare protocol. Because ultimately, if you look at it, whether a physician or of Western medicine or allopathic medicine or conservative medicine, because these three distinct names describe the same thing, compared to a practitioner of traditional Chinese medicine or a practicing acupuncturist. Ultimately, they're all providing a service, a value service to their communities in order to improve their health, wellness, and standards of living. These name nomenclatures, I think, both on our end, we must, whenever we're talking about our profession, whenever we're discussing our medicine, if you will, we must shy away from classifying ourselves as such. I'm a healthcare provider. What do? This is my specialty. I work in a specialized field that is within the healthcare system, healthcare mechanism.
The only problem is, of course, that if 98% of the world likes to think in little boxes, then automatically, even if you're an acupuncturist, which is, a healthcare provider, he's gonna use this little box, this label to announce himself.
Exactly, and this is where I think if you don't mind me interjecting, this is, I think, where we must change our approach. Because if we try to fit into a box, we're limiting our own potential.
Right. Let
us define our own box. Let us expand the box, if you will, that we're fitting into. Our medicine is much, much more than just needles and acupuncture points. It is an entire system that enriches the ability to be proactive in wellness. There's a fundamental difference between conservative approach to medicine and complementary approach to medicine. Mm-hmm. One is reactive, and I don't mean to say this in a way that, but one is good, the other one bad. No, they both have a very unique and very beneficial role in the overall health of a nation or a society or a community. A reactive medicine is ideal to deal with large-scale epidemics, pandemics, injuries, acute conditions that require immediate reactive action, responsive action. Mm. They're not structured in such a way to provide proactive, prolonged preventive care. So as such, I think the approach of combining these two mechanisms, these two systems in a healthcare system can gain benefits for both systems, for both practitioners and ultimately for the community in general.
Of course. And that's also the flaw of when using you could use, for example, traditional medicine or herbal medicine, but if you're using complementary medicine or alternative medicine, it depends on the situation you're in. Because, for example, if you're in China, the alternative medicine would be allopathic medicine.
Exactly.
Because they, in general, use more traditional Chinese medicine.
Exactly. In fact, that's an interesting point. Because if you think about it, if you look at the way proper medicine should be delivered, it should be in proactive way. So you can flip this structure. In the ancient days, there was a word of the saying that the sage practitioners never got paid for treating a sick person.
Yes.
They got paid for visiting and taking care of healthy patients. Yeah. This is a reverse thinking. You don't wait until you're dying to run to the doctor to get a pill or to get surgery. You continually maintain good health so that you can prevent getting to that critical stage. And then when you do reach it, if you do reach it, there is available mechanisms and systems that can assist you in a reactive way. So in that sense, like one of the best things that happened to the situation with acupuncture and traditional Chinese medicine practitioners in Los Angeles, in America, is that we were classified as primary care providers. As a primary care provider, I could be the first gate. A patient could come to me first and say, okay, I'm having a problem. And based on my assessment of that situation, I can refer them to all of the different specialties or all of the different appropriate schools of medicine, if you will, for addressing that either immediate, emergency, urgent care situation, or a rehabilitation type situation, or lifestyle changes, et cetera, et cetera. So in essence, you turn this into a personalized medicine. And I think there's a direction to go from the more generalized medicine to a more personalized medicine, because ultimately, even the Western or allopathic medicine recognizes, the modern science recognizes that patient A is not the same as patient B. So you cannot treat them all as a disease, classify them as such, and give them one medicine or one therapy. You must adjust or tweak your therapies according to the biome or the mechanisms involved in that individual patient, because we're all unique. DNA-wise, genetically, our intestinal biome is very different. Our response systems, our homeostasis is very different. So you have to adjust, tweak that. And I think if you put a generalist in the first gate that knows all the community, that understands the patients, they can quickly react. And what that does to the economy of medicine is, as you mentioned earlier very eloquently, is it reduces the burden on the already overburdened allopathic physician care system.
Yeah.
Because I can start working with people on day-to-day lifestyle changes, dietary changes, alteration to their practices to improve their well-being, rather than just constantly running to the emergency room or to the urgent care or to the hospital for simple ailments or simple remedies.
Yeah, and indeed, the traditional Chinese medicine is great for the gatekeeping role you mentioned, because you are taking into account all the different homeostasis from different people. So the World Health Organization, they officially promoted TCM in developing countries in 1978. And there's been increasing interest among developing countries in integrating traditional Chinese medicine into a national healthcare system, right?
Mm-hmm.
So most of these policies, however, they tend to be in practice a policy of coexistence and not full-on integration. Why do you think it's mostly coexistence for now instead of full-on integration?
A very interesting observation. Baby steps, I always say, baby steps.
Mm-hmm.
And I think given in many of the Western cultures, now, to regress a little bit, it's much easier to take a third world, underdeveloped country and integrate TCM into the protocol, because there are no set in stone mechanisms and organizations and policies and procedures and predispositions and ideologies that you need to overcome. Mm-hmm. So you can create a model that is already integrated and ease it into the system. In established already Western cultures, if you will, or developed countries, you have to ease it in. You have to ease yourself in. And the burden actually lies in two or three key elements, and we'll discuss that when we talk a little bit about how I think we can improve our chance of integration when we at a later opportunity. And the key here is coexistence gives us the opportunity to learn, to operate, interoperate, build networks, connect, establish relationships, and then build on those relationships. So as a step one, as a coexistence, I think it's perfectly fine, as long as we know that we make sure that our contribution to that coexistence is well recognized, well documented, and identified.
Right, and that's the important thing, our contribution within this coexistence being well recognized. Because what you also see is that, for example, people are using bits and parts of Chinese medicine, let's say dry needling, and then physical therapists are using it. And what you see is patients recognizing, or everyone has heard of dry needling, mm-hmm. but acupuncture is still out there in the alternative field. So the recognition is important.
Yeah,
I coexistence.
Absolutely agree. Absolutely agree. I think there's always going to be that component. Chiropractors ran into the same problem in America, but as they were merging as a new medical system. So even the AMA initially, when the American Medical Association was coming out, they were having all kinds of problems of establishing themselves among the practitioners as a valid approach, as a valid medicine. So I think that the challenge here lies in ourselves. We as a profession must identify ourselves as a unit, as a group, and we must do appropriate things to defend, enhance, articulate, and promote our medicine. And as far as dry needling or similar cupping, I've seen massage therapists do gua sha and cupping, etc. Moxibustion therapies. These are all components that can easily be integrated into other professions. So I always ask the question, if, for example, hypothetically, if your tooth is hurting, do you go to your general medicine doctor or do you go to your dentist? If you need surgery, do you go to your physical therapist or to a surgeon? If you need to have a wellness and a holistic approach, if you need to understand your body and how your body works and functions and how healthy your body is, you go to your primary care physician, which is your holistic doctor, your traditional Chinese medicine, your TCM practitioner. And that includes all of the modalities: acupuncture, moxibustion, dietary nutritional therapies, physical therapies, physical modalities, if you will, tuina. Many of the Reiki and chiropractic manipulations, a lot of them took source information from tuina to adapt to their practices. So this is not something new. The dry needling is not something new. It's just another reiteration of some professions seeing a unique benefit within the structure of our profession and then integrating it, co-opting, if you will, of that portion. And I think it's our job to make sure that that co-opting does not injure our overall standing in the profession.
Yeah, that's why our profession needs to be on the forefront, displaying the unique qualities of our medicine. So anyway, we're working towards the goal of unified medical system as the final stage of full integration, right? And this unified medical system should be an inclusive medical system, which could help countries to expand the available medical resources, right? So, and also keeping down the costs. What would you say, what do we need to do to effectively integrate traditional medicine into a modern healthcare system? What more do we need to do?
I think there's like 3 or 4, 5 key areas that I'd like to stress. First and foremost, we need to ensure that there's a wider availability of relevant scientific and clinical research that demonstrates our medicine's efficacy and function, benefits, if you will. And I think there's a lot of work already being done on that. But that is a double-edged sword, and I will discuss that why in a few minutes. The second, we must improve our educational standards. We must continually improve and enhance and increase our educational standards for our own profession. Not just, here's a 40-hour weekend seminar, now you can stick needles into people, which is what often happens with practitioners who co-opt acupuncture. They can go take a few weekend seminars and now they are practicing acupuncture in their clinic. Not the same. Thirdly, we need to obtain validation and recognition of our profession. This is where ETCMA and other local associations come into play, because this deals with politics and lobbying, building pressure and expanding our visibility, if you will. So marketing campaigns, et cetera, et cetera. Perhaps most important component is unification. We must, as a profession, have one voice. All of these associations, we must carry a similar message. We must have a similar presentation to our profession, to what does it represent in terms of a cohesive, integrated wellness protocol or a wellness mechanism within a community, within a country, within a nation, etc. And then successes, sharing our successes. I guarantee you, there are successes of integration happening all over the world. Integration of acupuncture in OBGYN, in IVF, IUI clinics has been well documented, and that's a success story. That can be patented, copied, controlled, and duplicated and expanded out, rolled out to many regions. as a toolkit to all of the practitioners in the various regions that says, okay, here's a toolkit that includes all of the research that has been done in this field, the success stories of integrating this field in the overall wellness clinic or wellness protocol paradigm, if you will. Now go and connect up with your local OBGs and your local IVF centers and present that message. In order to present that message, though, the presenter, the practitioner, must be knowledgeable, must be well articulated, and expand their skills and knowledge. You can't walk into an MD's office or an OBGYN's office and start talking about yin and yang and the zong and the fu and the 5-element theories, because within 2 seconds, they'll glaze over and you'll be classified as, oh, another one of those hippie hocus pocusers. So we must articulate, and this is why actually I pursued an MD profession, MD education, after having a quite successful TCM practice in Los Angeles, because I found that in order for me to really fully integrate into the Western or allopathic, the modern conservative medical system, I must speak their language. I must understand their language, and I must be able to translate our message into a language, into a message that they can understand and they can agree.
That's also why it's important within our own TCM educational system. We have to introduce a more or a higher level of allopathic medicine in that structure.
Not just allopathic, science in general. You know, the human body is a marvelous machine, but it is a machine. It's a biological machine. Mm-hmm. And so we need to start thinking systematically as a systems. You have an input and an output, and there's some black box that does some function to it. Well, the human body is a bunch of black boxes with inputs and outputs. And these organs, the homeostasis of a human body is maintained by inputting some hormone, outputting some additional hormone that comes back and works on the original hormone to maintain balance. Mm-hmm. The same thing with the nerve impulses and neurologic systems. The same thing with even within the TCM theories, the 5-element theories, one organ engendering another organ, processing, and then overacting or interacting with another organ. Transformation of chi, the formation of the various chi, is just processes that have a catalytic effect of one component based on 2 substrates that produces some new functional component. So it's not just medical terms and terminology. A lot of colleges and universities provide a good base knowledge of Western medical terminology so you can understand the terms. They provide a fundamental knowledge of anatomy as it relates to locating acupuncture points, etc. But I think we should go deeper. We should do physiology and pathophysiology. We should do cadaver studies. We should understand the human body from the inside. You're sticking a needle in a person. You must be able to visualize the tissue layers that you're penetrating. And any exposure to those types of experiences will only enrich the practitioner's ability to understand the human mechanism and how our medicine, be it acupuncture, be it herbal medicine, external or internal therapies, how it affects that internal system, that mechanism.
What about the future of TCM? How do you see TCM going forward?
TCM has been around for thousands of years. Mm-hmm. And the only reason why it has been around for thousands of years is because it works. One thing that does not work, you hear these fad medicines or fad therapies coming and going and coming and going. Every year or every few years, we get some new fad. Mm-hmm. Those that survive, those therapies, those techniques that survive, have proven themselves as clinically relevant and efficient and effective. Traditional medicines in general were developed as we evolved within the community. Remember, holistic. As a society, as a community, as a culture evolves within a specific geographic location or within a specific biome, they develop an inherent natural connection to that biome, to that environment. So as a result, they develop health and wellness interactions within that. herbs that grow in certain regions can benefit certain diseases or certain conditions in that area. Mm-hmm. So from a historical perspective, traditional medicines have always been and always will be part of wellness in the human cycle. How it goes forward from there really depends on us, the practitioners. Because as I said earlier, if we contain ourselves within the box of, okay, I'm only going to be doing traditional medicine, that I follow the 5 elements, or I follow the herbal therapies, or I do energy healing, etc. Great, wonderful, no problem. But you're going to basically limit yourself to the participation component, because now you're reliant on people who will find and direct themselves to you. Mm-hmm. If you expand your knowledge, your medicine benefits, your medicine is effective. If you can understand how that benefit can be translated into another language, and then articulate that language to your neighbor MD or to the chiropractor across the street, you have increased the opportunities for yourself, not just as a practitioner, but for the medicine, and ultimately benefit the community as a whole. So it's in our hands to move forward the integration of TCM specifically. And here in Europe, I see a unique opportunity, because Europe is a little bit behind, I think about maybe 10 or 12 years behind US. So this gives us, there's an old adage, wherever there's challenge, there's opportunity. So the challenges that I see here in terms of our ability as a unified European Union to integrate TCM into the various countries' medical systems is we need to learn from mistakes and successes of others who've come before us and who've done it, and take those lessons and use them effectively, leverage them.
Sharing knowledge and success.
Yeah, the key, if I were to summarize the message, if you will, is, first of all, my message to the practitioners, if I were given the opportunity, would be to, 1, strengthen your own knowledge, not just in TCM, but in all allopathic systems. Do some additional reading, build networks, and participate in online seminars. Learn as much as you can about medicine that is not within your privy. That only enhances your skills and expands your knowledge, if you will. Stop hiding. They're timid because they don't feel that they can present and be equivalent to an MD. So they're timid, they're hiding. Well, that comes from your ability to know enough to go and talk to an MD and present yourself as a potential add-on or a potential complementary approach to providing overall care. I hear a lot of people say, well, acupuncture is a placebo. Well, I'm sorry, even MDs say placebo is a heal, it's a cure. I don't care. If the ultimate goal of providing a value-added benefit to a patient is to make their life better, improve their outcome, reduce their symptoms, et cetera, and a sugar pill does that, I'm happy. Because remember, medicine, ultimate goal of a medicine, all of us have taken oaths, whether it's the traditional oath in Chinese medicine, whether it's the MD Hippocrates oath, to do no harm and to improve the livelihood of our patients. So that's the important thing. Stop hiding, get out there, engage, promote, research, and then ultimately share. The more we share, the more we unify as a profession, the more we unify our message, the more effective our integration will be within the community.
So we've been talking about mostly the pros of integration of our medicine within the community. What about, do you see any cons of this progress of TCM in modern society?
Yeah, I think one of the challenges that we're facing with, I mentioned earlier in our discussion about the available research and clinical and scientific data. There's an increase in this work that's being done. Up until recently, probably about 10, 15 years ago, 20 years ago tops, most of the research came from China. And most of that research was considered less reliable by the Western modern establishment of the sciences, because they were unsure of the appropriate control mechanisms, blinding, double blinding, etc., or the statistical validity of the analysis that was being performed. And so a lot of that data research, a lot of that data was not really accepted as valid proof. And what happened was, as we progressed, as patient demand increased, as our efficacy started showing in case studies and anecdotal stories, a lot of new research has been integrated into the field of acupuncture and herbology and Chinese medicine in general. The interesting thing that I believe is a challenge for us is a lot of this research is being done by MDs, scientists, non-TCM practitioners. Now, it has a plus and a minus. The plus is that we're getting validated by profession other than ourselves. So we can clearly say there's no bias on us. We're not biased as acupuncturists to validate acupuncture. Here's an MD that is validating, or here's a neuroscientist who's validating the effectiveness of acupuncture. So that's positive, that's a pro. The con is we're not in control of what happens after that research is shown as a valid information. Right. Because now an MD can take that, or a PT can take that and co-opt that component. Mm-hmm. And so we're in a precipice, I believe, as a profession in general. We can, if we don't act on it quite quickly and effectively as a unified front globally, not just in specific countries, etc., we may end up losing the battle and become relegated to a technical perspective. Acupuncture will become one small component within the general MD medical practice. Herbology will be developed into more phytotherapy research and drug development, etc. Right. Twin eye and manual therapies will be relegated to the massage schools and the physical therapy schools, etc. And so we will lose the heritage. See, it's not the needles and the cup and the gua sha that is the heart of our medicine. It's the wisdom that is engaged in all of these components. And that wisdom cannot be lost. That heritage cannot be lost. That is why I'm stressing it at every opportunity I get, to schools, to universities, to colleges, to individual practitioners. Learn the heritage, understand the heritage and what it means, and carry that, integrate that into your message. Because then we can take that positive news that an acupuncture benefits such and such condition that was conducted by a hospital in the United States, and leverage that into our profession. Hey, I'm an acupuncturist. I'm a professional trained in this at 3,000 plus hours as a profession, not some weekend seminar warrior that took 40, 50, 60-hour weekend seminar, and now I can implement this as a modality.
Yeah, I think that's a very interesting point you just made about integrating and stressing the heritage of TCM within our own educational system. And of course, it would be great if in allopathic medical school, it would also be a section for TCM.
That's very interesting. I'm very glad that you mentioned that, because what I'm seeing right now is interest from other schools, physical therapy schools, in trying to understand this whole yin yang and the concepts of meridians and acupuncture points and trigger points and pressure points, et cetera, et cetera. And so what we've done at our school at Athens College, and also developing messages and small snippets of presentations that takes the heritage and transposes it and extrapolates into Western medicine. Mm-hmm. So, for example, from an MD perspective, if you talk to them about the kidney water and the heart fire balancing out, you lose them.
Yeah.
But if you take that concept, which is basically describing the hypothalamic, pituitary, and the various adrenal or gonadal axes, the homeostatic network within the body, you start talking about that, all of a sudden the eyes go up, you know, they light up of an MD, because now not only he thinks, okay, you understand what you're talking about, and he can start making sense of what you've been jibber jabbering about, kidney yang and kidney yin and heart fire. So that's the message that we need to start expanding on, is not just the heritage for ourselves, learn a heritage, but then find a way to present that heritage in a way that fits.
Yeah.
And only then, you know, triple burner, Sanjiao, right? We hear a lot about it, and even within our own practitioners, there's varied degrees of understanding, appreciation, and using of the triple burner as a mechanism in health and disease. You try to explain that to a Western doctor, and you're going to lose them completely. But if you start putting it in terms that they understand, the fascial network, the peritoneum, the parietal and the visceral peritoneum, and the mechanism of fluid transformation that carries all of the interstitial extracts, interstitial components back and forth, all of a sudden they start making sense, and they can understand what you're trying to accomplish with your therapies.
They just need to be made aware of the transcript, the translation into their box.
Yes. Unfortunately, it befalls on us. We're they're the holders of the house, if you will. In order for us to enter that house, we must appropriately present ourselves as a valued guest for them to even accept us in. And I think the initial stages that we talked about earlier in terms of coexistence is a unique opportunity for us to do just that. If you slowly coexist and start working within 1-2 physicians, demonstrate your ability to contribute, to participate, to add value to the overall patient outcome, pretty soon you develop success stories, you expand on that, and every one of these doctors become a mouthpiece, become a representative of yours in the general world. Right. And that will increase our ability to integrate well.
Well, we could go on and on, but of course, I'd be happy to have you back on this channel and maybe discuss your book in the future. For now, thank you for sharing your thoughts on integrating TCM, sharing, like you said, sharing success stories through various channels, getting it out there, for example, through this TCM community or your own video channels. That is also the key to success in integrating Chinese medicine.
I agree, and we must leverage, and I urge every single practitioner that's watching this, leverage your local associations, leverage the ETCMA association. We're there as a resource to you. If you need additional information about some story you heard about some success somewhere and you want to know more about it, if you heard of a research that was done and you want to know more about it, if you want to learn how to articulate a certain part of TCM message into a Western message, that's what we're here for. As part of the research task force, we're constantly putting together our research materials. Just our recent webinar, we announced a infographic which looks at pain in general and how acupuncture fits into pain. And we've given you statistical data, valid research data, and in visual format that you can cut and paste and clip into your presentations, make brochures, whatever you want. So the tools are there, leverage them as best as you can. It's not just some one person's video channel or one YouTube channel. The resources are there. Integrate and work with them. Thank you.
Okay, so on that note, thank you, Dr. Aram Akopyan, and we'll see you next time here on the TCM Community Channel. Thank you.
Thank you. I look forward to appearing. Bye-bye.